We are Vitrue Health, and we develop tools to help physiotherapists and other clinicians assess patients with musculoskeletal conditions. So what I mean by that is everything that affects the way you move, from an older person having a hip replaced to a professional football player who's torn their ACL to someone who's just gone over on their knee. Most people will be aware of that. Most people have seen a physiotherapist for some form of injury. So they'll know that a lot of the diagnostic in that world relies on the clinician's sight. So we don't give physiotherapists or surgeons tools to diagnose you until you're basically falling apart, till you have something seriously wrong with you. A lot of their diagnosis relies on their sight. So they'll ask you to perform various tasks like stand up from a chair or do a squat, and they'll judge based on sight how well you perform it and try and come up with their diagnosis and their treatment plan. As good as physiotherapists are and as good as surgeons are, it's extremely difficult to do that by sight. It's just not very accurate trying to judge with your eyes. So what we're doing is using computer vision based technology, so cameras, to augment that assessment. So our device sits in the background of the same assessment. You go and see your physiotherapist the same way you would today. You do the same movements, the squat or the sit to stand, but now the camera is automatically tracking your performance and giving quantitative, objective numbers on how you performed. So there's two major goals. One is we want to give the clinician the best possible information for making their decisions. And then equally importantly, two, we want to give the patient some data they can engage with so that they can understand what's wrong with them, why they've been prescribed a certain treatment program or rehab program, and they leave really engaged with their musculoskeletal health. Regardless of what your innovation is, the most impressive technology is useless if it doesn't fit into the practice that exists. You can't completely change a clinical pathway based on a piece of technology. You have to work with how things are. So a lot of the challenges we have is to get the super high tech stuff in a package that just is practical and viable in an existing pathway. So time comes into that. Things like we avoid attaching things to the patients. We want to make the interface as easy as possible to use so that both the clinician can understand it, but also explain it to the patient. It's all those kind of human factors parts that make it something that can grow and be adopted across healthcare. Our core product, our core technology is designed for use in the clinic. So patients seeing physiotherapists. And with the isolation period, that has obviously gone through the floor. It's just not anywhere near the number of patients actually physically seeing their physios. So for us, that means that we have to look for different ways to help the physio community. Obviously, it will come back and our core product is still clinic focused. But for the 6 months that it's disrupted and for the remote physio idea is not going to go away, remote consultations is going to stay a thing after this. So we have had to look for ways that we can help the physio world through that. For us, remote was always in our roadmap. We always thought at some stage we want to get it right in the clinic, but then also bring the home into it. This whole world of COVID and isolation just is a huge push to bring that forward. So we started with a few different things. We looked at, first off, some fun things. So we did the Desk Break Challenge, which was using your webcam. It challenges you to do a squat. It tracks your performance of the squat and you control a game. Lets you compete with friends. The whole idea of it is just to get people up out of their desks. It was never intended as a product for us. It was kind of a way of us just getting the technology out there that might help people be a little bit more active. Since then, we started looking a little bit more seriously about what we can do clinically. Again, using computer vision, because that's our kind of core algorithmic knowledge. So your webcam to track various things about your musculoskeletal health. So the first thing we launched is called Vitrue Desk Assessment, which is vitruedeskassessment.com, which uses your webcam to track your posture and track the position of your laptop versus where it should be. So we've got tens of millions of people right now sitting at home, hunched over kitchen tables. Most people listening to this will probably be in that position when they listen. And that has a massive impact on your musculoskeletal health. So helping people to set themselves up properly in their home to make sure that they've got a proper work setup, the goal is to reduce those issues. From there, we're looking at all sorts of things. There's about 60,000 operations a month being cancelled in the musculoskeletal world, that's in the UK. And those people are having to live with the painful conditions that they have. So we're looking at all sorts of things to see what can we do to help physios remotely help those patients manage that pain and to do whatever prehab is necessary or whatever condition or exercises will help them reduce that pain. So for us, this summer is about adapting some of our core knowledge to help remotely as well as in the clinic. So the long-term vision for the company when we set it up was there is no gold standard diagnostic technology to help physios do their job. So where doctors get blood tests and surgeons get x-rays, right now physiotherapists don't really get that help from the world of engineering and technology. and we want to give them that. So in 5 years, the aim is to be the gold standard musculoskeletal health assessment across healthcare. So whether you're talking about arthritis or stroke or elite sport, and that's still very much the kind of North Star that we look for. Along the way, there's obviously all the regular KPIs, and we want to do international expansion. There's several different trials that we should be running right now, but are delayed a little bit. We want to publish those peer-reviewed studies. There's all the typical roadmap things for a medical device. But everything we do, we have it up on our wall in the office, we try and do with the goal of becoming the gold standard assessment.